Assalamu alaikum and a very good morning to you all. It's an honor and privilege to have this opportunity to present my paper in this prestigious forum. The title of my paper today is Factors for Earlier Local Recurrence in Extremity Soft Tissue Sarcoma, Findings from a Tertiary Care Hospital. For myself, I'm Dr. S M Sakib Kabir, had my MS in surgical oncology from National Institute of Cancer Research and Hospital, and currently I'm working at a 250-bed general hospital in Khulna. Sarcoma. It's a notorious disease, but it consists of only 1% of the whole spectrum of malignancies. And its classification is so diverse that WHO had to publish a separate book on its classification. And you can also appreciate how complex it is from the wheel chart here. And it affects most of the time the extremities, up to 60% of the cases, and the mainstay of management is usually surgery. But surgery is often complicated by local recurrence, which occurs in up to 20% of the patients. And this 20% is a huge number in a densely populated country like ours. But while its management, to a surgeon at first, it presents as a lump and it feels like an easy job to do. But after the first recurrence, for young surgeons like us, it's a matter of to get worried. But after second recurrences, it's frustrating. Oh God, why is it coming back? But after multiple recurrences, we feel like telling to the patient, sir, I don't know you, you're not my patient, you may go to some other consultants. And I feel like disappearing from the scenario. But to address this issue, we need to have extensive knowledge about the prognostic factors and that causes local recurrence, and which is unfortunately scarce in our population due to lack of data in literatures. And our aim, that's why, was to evaluate the impact of the prognostic factors for earlier local recurrence, for a better management and improved recurrence-free survival of our patients. And specifically, we wanted to see the impacts of surgical management, histological types, and adjuvant therapy status and margin status on local recurrence. Also, we wanted to find the association with the time that took for recurrence. We thought if the time taken for recurrence is significantly earlier for a factor, then this factor or that factor might be a reason for the overall recurrence of the disease. It was a cross-sectional observational study, and it had both retrospective and prospective arms from January 2021 to 22, and it was a purposive sampling at NICRH. And out of 117 patients, we took only 70 patients based on some criteria. Usually the criteria was they had to be diagnosed as recurrent case from our MDT, and after 6 months of initial therapy, those who had complete documents for their initial staging and other operative notes, and those who are not willing to participate and with metastatic disease were excluded from the study. We developed an app ourselves for the study. We used Google Forms and AppSheet. Of course, both of them were free for the documentation. We developed the questionnaire, and reports and documents were then included into the app, and patients' particulars were also included so that we can trace our patients through their numbers or through their location. And after that, all the data were taken to the Excel, and from Excel we exported to SPSS for analysis. And after the analysis, we found that most of our patient group were the younger generation. Might be the reason that most of our population in our country are young, and that's why the younger generation are more affected. And there was no specific demographic characteristics that were responsible for earlier recurrence. There was no statistical significance there. And according to the location of the tumor, it was more affected at the thigh. The literature says that thigh has a huge bulk of tissue, more connective tissue, more muscles. Then that's why this might be the reason that recurrence is more at the thigh region. And while diagnosis, we were unfortunate to find that most of the patient didn't have any preoperative tissue diagnosis, and it was up to 74% of the patients. And core cut biopsy, which is important, was done in only 22% of the patients. And immunohistochemistry, which helps us to classify the type of sarcoma, was unfortunately very low, and most of the cases it was not done. It was only done in 1% of the cases in preoperative settings. And for surgery, wide local excision is always recommended, but we found that most of our patients at least 64% of the patient had unplanned surgery. We considered wide local excision and simple excision with preoperative tissue diagnosis as planned surgery. The rest were considered as unplanned surgery, and unplanned surgery was a huge number. And this was statistically significant also, that unplanned surgery causes relatively shorter time of recurrence. That means if the surgery was unplanned, the recurrence time was significantly low. And also, we found that the time to recurrence was within 2 years, but our patient had a mean time of 13 to 19 months, which is below the standard of Western literature. And also, adjuvant chemotherapy and radiotherapy, if they skipped, they caused local recurrence earlier. And from histological point of view, we found that fibrosarcoma, UPS, and synovial sarcoma were the most common sarcomas in our patients' presentation in Bangladeshi population. And there is one interesting finding that we got, that less than 10 centimeter of the tumors has a relatively earlier recurrence, and margin involvement causes more recurrence, and also it is associated with preoperative tissue diagnosis. If not done, causes more margin involvement, and tumor size less than 10 centimeter causes more margin involvement. And from multivariate analysis, we found that adjuvant chemotherapy, radiotherapy, and margin status were the most important factors for local recurrence, and it also shows in our survival curve. So in conclusion, we can say that local recurrence is a challenge for both the surgeon and the patient, and we have some unique findings in our population, like less than 10 centimeter tumor has more vulnerable to improper management and early local recurrence, and lack of preoperative diagnosis, eventual unplanned excision leads to significant local recurrence. So our recommendation, think twice before jumping on into any kind of lump, because it might turn into a sarcoma. And patient's education is necessary, and our follow-up schedule should not be like the Western schedule. Our follow-up schedule should be frequent, because our time to recurrence is low. These are the references, and these are some of the pictures of surgery and reconstruction of the sarcoma patients. And yellow is the color of sarcoma, July is the month. We hope that our patients will get the best care regarding sarcoma in our country. Thank you very much.